in those experience, what if there are, what are like major difference in dentistry from different countries? Did you notice major differences?
It's how you deal with people. Dentistry itself is a very intimate profession. You're going to be very close to your patient. You're going to talk about very personal things that the patient is experiencing. So the way to approach a patient, the way to get their trust, the way that getting them to accept the treatment that you're proposing to them changes from one culture to another.
Hola a todos y bienvenidos a un episodio más de su podcast Dentíficamente Hablando, un podcast donde hablamos sobre literatura dental y de todo un poco de vez en cuando. De nuevo, el día de hoy nos acompaña el doctor Ernesto Salazar, un invitado que ya prácticamente es un co-host de nosotros. Hola Ernesto, ¿cómo estás?
Hola Juan, mucho gusto y muchas gracias por la invitación como siempre.
Perfecto. Y también el día de hoy nos acompaña un invitado, de nuevo, como siempre, VIP, el doctor Wakeel. Doctor Wakeel, welcome to your podcast.
Thank you. Thank you for having me in. Thank you, Juan. Thank you, Ernesto.
Great, great. So, para los que nos escuchan, recuerden que, bueno, la sesión de hoy va a ser en inglés, pero recuerden que pueden activar ahí la traducción directa en las plataformas, principalmente en YouTube. ¿De acuerdo? Bueno, dándole la bienvenida al doctor Wakeel, recordemos que él es un eh, profesor asistente en la Universidad del Pacífico, Arthur Dugan School of Dentistry en San Francisco. O hizo sus estudios en la Universidad de Malasia y tiene varios posgrados de las universidades como Manchester y la Universidad Internacional de Medicina. Entonces el doctor nos va a estar acompañando el día de hoy. Vamos a estar hablando un poco también de su experiencia como codirector en el ITI, el Scholar Center, por allá en San Francisco, y con diferentes, cómo ha sido su experiencia por ahí. Principalmente enfocándose el doctor en la parte de la rehabilitación oral completa y prostodoncia fija. Así que estén pendientes y espero que disfruten el programa. Gracias. So, Dr. Wakeel, again, welcome to your podcast. And okay, let's start this podcast today. And asking one of the, for me, when Ernesto, introduced you to me, I was interested on your background around, going different places. And you have this experience of, being in different places at different times in your career. So how those experiences influence your clinical and academic philosophy, and how those experiences have shaped you to become the dentist you are today? So would you share a little bit of that?
Yeah, of course. Yeah, that's true. That's very true. I traveled a lot. I've been in Iraq and then Malaysia and then the UK and then the US, and I've taught and practiced in all these countries in the same different times, but within the same context of practice and specialty most of the time. How did it shape me? I think mixing with people, seeing many cultures was the best um, experience I've getting from traveling to different countries. Having to be with different people, different backgrounds, the diversity, people interest, even the languages have shaped me a lot and gave me a perspective of what people like and what people enjoy and what people does in their even in their free time. I've made friends. I've made close friends in every country I've been at during my travels. Uh, some of them, it's still in contact with me until today.
In those experience, what if there are, what are like major difference in dentistry from different countries? Did you notice major differences?
It's how you deal with people. Dentistry itself is a very intimate profession. You're going to be very close to your patient. You're going to talk about very personal things that the patient is experiencing. So the way to approach a patient, the way to get their trust, the way that getting them to accept the treatment that you're proposing to them changes from one culture to another, from one country to another. And all these travels actually gave me a broad spectrum of tools that I can approach patients in different ways and get them to be interested in the treatment that I think it's best for them. I'm not trying to convince them of the most expensive treatment. Instead, it's what's actually gonna work for them in for their teeth, for their mouth, for their lifestyle that they're having. It makes easier choices and predictable acceptance from patients when you know how to deal with that culture that you're dealing with.
That what you mentioned is very important, not to offer only the treatment because it's expensive, because obviously we're in this for a living, but the patient care is also very important as well. And I mean, I can offer, I don't know, the Ferrari of dental treatments, but if I'm not invested in it, if I'm doing it just because I want to gain something out of it, I don't think that our relationship would be good with the patient, and the results that we get will be suboptimal at best.
It's also fair to say I would think to, you know, with with the social media, the trending treatment in some countries like Europe and United States are not applicable, or you know,
Absolutely,
Yep,
probably
exactly.
not
absolutely.
Exactly.
to
What
other
people,
parts of the world, right?
yeah, what people request in one place is totally different what people wants or needs in different place. As well as we know in medical research and then dental research, the background and the what do you call it? The your where your descendant from,
Hmm.
it actually changes the outcomes and the type of disease that you
100%.
get affected and the type of skeletal pattern that
Yeah,
you're having. All these things changes from one culture to another,
yeah.
from different backgrounds. So with that, you will actually start to um, make a diagnosis probably faster when if you have been exposed to all these.
Yeah,
Yes,
that's true.
absolutely. And there's a thing that we usually don't understand as medical professionals or dentists or whatever you want to call it, because I see the teeth should be white, let's say. So I offer whitening of teeth. Yeah, but it's not white enough. Let's make it more white and more white and more white and more white until it's unnatural. And it's ugly and it's very bad, and then the same thing happens with dental implants all over the place. We have a tooth decay. Okay, an upgrade for the tooth is an implant. That's just a ridiculous statement. It doesn't work like that. Yeah, the message that you're giving us right now is very important, I would say.
So I understand that you are focusing on prosthodontics, right?
That's right.
Even
That's my
though today
specialty.
you are an ITI, you still focus on the prosthodontic and restorative part of the implants, correct?
That's the beauty of ITI actually. It's a marriage between prosthodontics, periodontics, oral surgery, all combined, sitting together, making consensus for the world.
So what motivated you, you know, going in different places? What was it? Was there a point where you decided, I want to become a prosthodontist, and what was the motivation?
To choose my location of my specialty.
No, the career path that you chose.
Oh, why
But
prosthodontics?
since you mentioned
Yes.
it,
Yeah, yeah,
let's make it two questions.
yeah, yeah. I think what made me choose prosthodontics itself is my prosthodontic teacher or professor back in when I was doing my DDS degree. Um,
That was in
Malaysia,
Iraq, Malaysia. Okay,
Malaysia, that one, the DDS degree from Malaysia.
okay.
Yeah. Uh, the professor, although yes, he was very elegant, he was very professional when talking. His lectures were very easily absorbed and very easily understood. Um, but on top of that, um, we had a case, or I had a case that he helped me supervise during that time with very resorbed ridge on the mandible, and we were making a denture for the patient, one of the simplest treatment plans for the patient. We're doing just a denture. And the patient had, I think, 5, 6 dentures before, none of them worked for the patient. And he was teaching me a technique of finding the neutral zone in the of the arch and where the teeth should sit, and the size of the teeth matters so that the tongue doesn't interfere, and the lips and the muscles and the tongue muscles all are in equilibration, so it keeps the denture in place. And he went with me. He held my hand basically, uh, all the way from the impression to the teeth setup to the delivery stage. Shout out for him. He's Dr. Muzaffar. He's still in Malaysia. He's still practicing prostodontist in Malaysia now. But what he did and the outcomes of the treatment and how the patient was appreciative, and how for the first time a lower denture sits in his mouth and not flipping out when he's speaking. It was something that I aspired, and I wanted to be in that specialty. Although when I actually graduated, when I finished my DDS degree and I graduated, I was like, I want to do more surgery. And then uh, I went into an early stage of being an oral surgeon, but that did not sit well with me. The lifestyle that they have and the on calls and all these things, it did not sit well with me. I wanted more relaxed environment for that. So I was, all right, I want to do prosthodontics. I like the specialty. Uh, what can we do? And in Malaysia, it's one of the Commonwealth countries. So they're all oriented towards having specialties from the UK. And that's what I put my application. And it was not an easy application because, for someone who's coming from Iraq and Iraqi passport, it's not easy to get visas and travel around easily. So I got accepted in King's College London first,
Wow.
and the program was about to start, but my visa was not out yet, and I had to juggle myself to find a different place. So I was looking for another program still within the UK, and the University of Manchester was still open to accepting students, and that's where I put my application. Visa went out easily after that. Um, Once you start traveling, of course, life would become easier. You get accepted easier, and moving you start to move easier. But that's basically what got me into Manchester, and it was the best 3 years of my life.
Wow.
I got
In
to know
Manchester, wow.
in Manchester, University of Manchester.
Because of the beer?
Actually, the beer was good. I got exposed to a totally different culture than what I'm used to. Sophistication of the UK,
Yeah.
the high teas and the Sunday boils and all these things. It was fun. It was a lot of fun. The instructors were down to earth. They were very willing to teach.
Wow, that's good.
They even brought us into their clinics
Wow.
to see them doing their own patients, and then uh, we did plenty of cases in there. Uh, it was fun, and no one held back in terms of knowledge. I enjoyed every experience I had over there.
Well, you say that did you have a mentor that specifically got through you? Like, there's like this moment with this person made me the person who I wanted to be or who I am
Mm.
today. And another thing that I want to go back to after tell us that is that's the thing about success. Nobody sees all the things you go through, all of the things that you do, all the days that you stay up all night, that you
A
don't go to.
sleepless night.
Yeah, nobody sees that. We were talking about that the other day with Juan and somebody else. All the people see is, yeah, he's living the dream. The what dream? You have no idea how difficult this. Before it was a dream, it was a nightmare.
It was.
Yes.
It was. It usually starts with a nightmare,
Yeah.
lots of hard work, sleepless nights, and yeah, you end up hopefully doing what you like to do.
Yeah,
But
I
yeah,
have. Oh,
go
yeah,
ahead.
yeah. No, I have 2 points on that because I think on this story is that you had someone that inspired early in your career.
Yeah.
I think
Mhm.
this is, having a mentor. That's something that also Ernesto just said is very important for I think the development of like a potential like successful future dentist. I would say, and I think maybe everybody has someone that said, okay, because of this, I want to be better. I want to become a prosto,
Mhm.
etc. And the other point I would like to mention for those of us that like prosthodontics, that change when you also mentioned that, it was just a simple denture.
Yeah.
But, that feeling when the patient smiles and see the transformation of not having teeth and then having be able to see themselves with teeth and of course the rest of this establishing again their function that feeling is also what for the prosthodontics because our friend here he hates prosthodontics.
Oh, it's the same thing.
Yeah.
I think everyone
It's
likes
prosthodontist.
we're all aiming to restore teeth, whether with artificial teeth or whether with natural dentition. We're all trying to save them, keep them as long as possible, or restore what's missing of them. We're all aiming to that direction. It's just what you like to do and to reach there.
One extra question, do you drink beer?
Oh yes,
Oh, look at
Okay,
the answer. Oh, yes.
oh
okay,
yes.
okay.
Like
So
I'm
is it
actually an IPA drinker.
uh
I don't like IPAs.
IPA drinker.
I don't like IPAs. They cause me the worst headaches in life.
Oh, you didn't drink the right ones then.
Oh, okay. Okay.
So in Iraq, is there like mostly Muslim the population? Is that correct or I'm confusing?
Uh, I would say, yeah, you're right. About majority, yes. But
Yes.
in terms of what others in there, there's plenty.
Yeah.
There's even
But the
religions that's not
minority,
even
right?
exposed. Yeah, but there's even religions that's not even exposed to the public. There's
Okay.
plenty
Oh,
mixed in there.
really? Oh,
Yeah.
wow. So okay, so you enjoyed a nice beer. That's good. If we have the chance to meet sometimes, yeah, we
Which
should
you
we should
should,
share a
because I
nice
told
beer.
Dr. Wakeel that we have to invite you here. So
Yep.
yeah.
Yeah, if that's possible, yeah, I would like to. In San Francisco, I know there are some pubs or some bars that have like very
Oh,
good
there's major
beer. So
breweries that supplies the
yeah,
world with beer. You're gonna have
so
fun.
We
that's why
fun.
probably you're thinking of settling in San Francisco, maybe.
Well, it's not about the beer.
Okay,
Not only about the beer.
not
The
only
beer is
about the
good.
beer.
The beer is good here, but there's good beer in every place I've been at.
Oh,
But
okay.
San Francisco has a special place in my heart. I've been here for this is my fourth year in San Francisco. It feels like home. This is the place that you get a mix of every culture
That's true.
in here. People here are very respectful, very nice. There is
Also true.
everything available for every taste.
Yeah, also true.
There is something
Literally.
to do every day.
Literally.
There is hikes, there is pubs, there is nightlife, there is brunches. There is it's a very inclusive community in here. I feel like
Nice.
a salesperson for San Francisco sometimes.
I
Well,
would
you
like to
do.
see that in first person. Yeah.
Well, you
Yeah.
do that very good. Let me tell you.
Mm-hmm.
Okay, so would you consider would you consider drinking beer a hobby? And if so, what other hobbies do you have or passions? Besides, of course, dentistry and beer.
I would, if we're talking about drinking hobbies, I'm a bourbon hobbyer.
Oh, bourbon?
But
Mm.
other hobbies, something that even Ernesto, who's been here for a year now, doesn't know about. I'm actually a very good fish keeper.
Oh, really?
I actually keep
Oh.
fish and I breed fish as well,
Oh, really?
different types.
You breed fish?
Yes.
What is that?
Well, you know those aquariums,
Yeah,
small aquariums, you
yeah,
keep fish and you do these things.
yeah.
Yeah, I have plenty of those. So yeah, I
Wow.
keep fish. I At some point in my life, in Malaysia, I had like 16 different aquariums in my house.
Wow.
So yeah, this is
Do you
something
have the space?
in Malaysia I had the space. In San Francisco, it's a bit difficult. It's a bit more expensive to get big spaces in here.
Wow. So my two bosses are obsessed with small animals.
Hmm.
Mm.
Hmm.
What was Bedrosian obsessed about?
Bees.
Bees. Okay, he's a beekeeper.
I wouldn't say he's a beekeeper, but he gave us a bee message.
Oh, okay.
The P message. Yeah, that's right.
That's true.
Oh,
Yeah,
so that's
I do
that's
have.
interesting. Is
Yeah.
is is it hard to breed fish and keep them?
Now, if you have the knowledge for it, it's not hard at all, actually. It takes time, but it's very relaxing exercise for me. This is what I spend in my free time, actually.
I will say that that's the same thing for teaching. Teaching is difficult, is it? Well, if you have the knowledge, but if you have the
But
knowledge only and
yeah.
you cannot teach, maybe you won't get through anyone.
Mm.
I will say that Dr. Wakeel is one of the best professors that I have ever met in my life. And that's saying a
You're
lot.
saying that because he's there.
No. No, no, no. I've seen him, and I honestly think he is. These guys maybe don't realize how lucky they are here at UOP of the program that they have in dentistry. When you come, you will see it's very advanced, and
Mm.
they do a lot of clinical work, and they have
Mm.
really, really good professors like him, for example. They do digital works, and I mean they're exposed to it, not only looking at you doing it, but they do it themselves as well.
Mm.
They have implants enrichment programs with the actual dental student place more than I don't know how much is it, 20 implants at least.
True. Yeah. Every student by now they should be at 2025.
Can you imagine?
Mm, wow.
They're about to graduate with the 20 implants that were placed under their hand with the guidance of Dr. Wakil. So the next question that I would like to ask is how do you keep students engaged during your lectures or your hands-on sessions, and also how you do incorporate the digital work in your job for them?
Now
Mm.
moving to more serious issue, right?
Yeah.
Enough of personal life, right?
Wow.
Uh, Keeping student engaged it was one of my most challenging uh, experiences when I first moved into teaching. The the bigger the class, it gets even more complicated because now you have a more diverse group of students that each one have their own needs. I think the best way to keep student engaged all the time is to keep the slides simple and straightforward. Uh, Put the message that you wanted to deliver to them is right there in front of them. Number one. Number two, make it very relevant to them. You, it's not. This is not a conference anymore. It's not showing how good is your work anymore. This is more making it approachable to them, making it doable to them. Not complicating it, instead simplifying it, related to them. A lot of times you will see me, I try to relate it to something they are more familiar with. So I'm trying to relate an implant crown to a normal crown because they've been doing plenty of normal crowns or natural teeth. I try to relate it to them and I bring the concept closer to that, and I'm telling them, well, this is, you know what you do in a normal tooth crown. You need to adjust the occlusion to prevent interferences. It's the same thing for an implant. However, you have to do it this way. You have to change this part of it. So it's basically trying to make complex concepts to be simpler and easier to remember. A lot of times you will see me putting abbreviations to them. You will see me having a story to tell about it. So that's something that will stick in their head. I never ask questions that require memory from the student. My philosophy, if something you can Google it on your phone and find the answer for it, this is not something they should be asked about. This is not something that they should memorize them because they have access to it. What I'm trying to get into their heads is an analytical way of thinking of things, always relating it to the reason that you're doing that. So always ask the why question. Like, why am I adjusting the occlusion on that crown? What is it going to be benefiting to the patient? And what's harm going to do if I'm not doing it? So that the reason of doing the thing, that's what sticks in their head. Well, that's at least what I found, what sticks in student heads. That's what they will remember eventually, not the things that they memorized. When they just memorize it, probably by the end of the semester, they forgot about it. By the end of the exam, they don't, no one will remember it. The other things I do with the students is I get them really involved in the assignments that they are doing. Rather than just doing it for the doing it, I want you to take pictures of the things that you're doing. You're doing a provisional crown bench top, a provisional crown for your implant. All right, let's take picture of every step and submit them on Canvas. I am grading the student eventually on the bench top straight away. I'm giving them a grade on the outcome of their participation. The reason I'm asking them to take pictures and submit it on their online platform is, first, they are taking pictures of the important steps that they are doing,
So that it's
so
good.
that they will remember. Number two, they will have that picture on their phone. They will refer back to it when it comes to the day that they're actually going to do it in the patient mouth. They actually can go back to these pictures, even though it's been taken unintentionally. It's been taken for the reason to submit it for getting a grade. They have it in their phone, and whenever they actually do it in the patient mouth, it's already in their phone. It is difficult to teach implantology in general because probably you get to try it one time on the benchtop. The second time it's inside your patient.
Yeah.
Our school as well is a 3 years program. It's not a 5 years or 4 years program, 3 years program. So everything is compacted. There's no holidays, there's no breaks, there's no time to get the students to do 10 implant crowns bench top before they do it in the patient mouth. They're probably gonna see it one time, bench top, and then that's straight away the next
That's
part.
good. Yeah, that's good.
Yeah. So
Yeah, I would say
having
so.
them taking pictures, having them submit them online, getting them to get involved and asking questions like, why am I polishing the emergence profile of that provisional crown now? Why am I forming the soft tissues around that provisional crown? All these things, if they know the reason for it, then probably they will remember to do it
Yeah.
later on.
Yeah, but that what you said is good. I think throwing a person into the water and and tell them, hey, go swim. That's a very valid, good learning technique. That's how I learned. Never in my life I had the same things. Never.
Mhm.
I don't know about you, Juan, but I never did. Everything that we so it was like I don't really remember, and I don't want to say things that probably are going to be like an invention of my memory, but I don't really remember going to practice. Oh, maybe we did practice in plastic teeth and all of that, but I don't really remember anything other than that. So do your practice and then just do it in the patient. You see it once and that's it. Good
Yeah.
work. Yeah.
I mean, that's the 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 way dental schools
Yeah, that's
are
yeah.
made. You don't have time to do a lot of exercises. You have a lot of time. You need a lot of time to be doing on patients.
Yes.
So you get to try on the bench top maybe once or twice, but after that it's your patient.
So, I was, you were saying that you're making this a little bit more interactive for the students. And recently, you have one of your papers actually talks about this, right? This is one of the recent articles you published with your team about the interactive tutorial for enhanced and removable partial dentures. It's not implant, but what could you give us ahead of time, because we will share this article, the link, so our audience can go and check it out. But what would you tell us about it a little bit, or the conclusion, the main ideas of this research was?
Well, basically, it's about partial denture designs. One of the most um, this concepts in dentistry that's always gotten wrong, and usually students will graduate. They don't actually design their own dentures. They will give it to the lab, expect the lab to design it for them, and send them a denture, which
It's the
is
same everywhere,
it's
apparently.
exactly. It's not. I've been in 4 different countries practicing dentistry. Eventually, the general practitioners, they don't actually sit down and design the denture because it's just the concept of it. It's a bit complicated, and there's different ways that you can do the thing. What we've done in this, we created an online platform for the students, and they basically you just have to click on what patient is in front of you and what's missing in their mouth, and will straight away, instead of having everything in your head getting mixed up, it straight away zooms in for you the design and removes all the things that's not applicable for that case, and it keeps to you the most relevant options available from your denture design. The only thing you need to do in the end is basically just picking what works for that patient, depending on the condition of the tooth that you're planning to use as abutment for the denture. And we tested it. So we gave it to students. We gave some students, gave them then the models, the conventional way. We gave them the models, asked them to design the denture. And the other students, we gave them the models as well as the link to the website to help them design. And the outcomes were astonishing. Those who had the link and they can relate the case to the link and design based on that, it was much easier for them. Time-wise, accuracy of the design, predictability of the outcome, it was all better. And the students' feedback was amazing too, because they didn't have to go and spend hours researching on what could work. Instead, everything was compiled in front of them. The website or the link itself is based on major textbooks in removable prosthodontics.
Wow.
So the designs are very applicable. And for a general practitioner who's planning to do some partial dentures, that was a very easy pick for them.
Wow.
I think this is one of the biggest changes, not only in education, but the use of technology for treatment planning and diagnostics and treatment planning, right? But I mean, a big change, because an old professor would say, "Oh, but you don't know what is a class 1, class 2, class 3
Yeah,
and
that's what I would say. I'm not a
the,
null
the
professor.
the software will tell you, oh, this is a class 2, something like that, right? Or a class 4, whatever.
Uh-huh.
But you also mentioned earlier that, of course, memorizing this may not be as productive for today's dentistry, or not
Uh-huh.
only productive, but also more, how do you say, efficient and correct.
Uh-huh.
So how would you, because I think you are accepting that change and put it into work with your students. So how would you recommend, or what would you say to someone that still doesn't like this change that is happening?
So here.
Uh, I don't know if you can share or pull. It's a graph available online about early adopters and late adopters.
Early adopter and
Late adopters graph.
okay, let me check for it.
That graph is very famous, and I have it in a lot of my lectures actually, and a lot of people have a lot of iterations on that graph.
Okay,
You can send it to me if you like, so that we can confirm before.
let me see if it's this one.
There's a lot of cartoons and out of that.
Anyway, in the meantime, while you look for it and you find it, maybe we can move on to the next question. Probably a little more related to ITI and dental implants, if you'd like, because I see a lot of interesting things in Dr. Wakeel's life. But I would like to know what inspired him to enter.
Hmm.
What? Oh, there you have it. But
Is this the graph you mentioned? Something about
Yeah.
this? Okay, so before we move to ATI, let's
okay,
finish
Yeah.
this idea for the early and late adopters. So, yeah,
So this is actually what I show usually when I'm talking about technology in dentistry. There is 2.5% of the population who are innovators. These are the ones who create the ideas. They actually just invent something and they try it out, and they are the one who build over from there. They are the one who has the patencies usually for these things. Now, there is the 13.5% is the early adopters. I like to think of myself as one of the early adopters. Problem with the early adopters is you end up doing a lot of the work because you like the idea, but you're trying to make it work. So you're putting all your efforts trying to get the innovation to work to within your field. And there will be a lot of mistakes and a lot of wasted time, but eventually you end up coming up with a protocol for yourself that probably before anyone else started that. The early majority, 34%, they wait for the early adopters to create a protocol and show them what to do, and they started accepting it once they see positive outcomes from it. Late majority is those who wait and they want to make sure that everything 100% works. Those are the ones who wait for sometimes 10 years, 20 years for a thing to kick in and become feasible and easy to use and more user friendly. Then they start adopting it. But there's always those 16% who, whatever you present for them, at the end, they will say, "It. This is how I do it. It works in my hand. I'm not changing it," which is fine. It works in your hand. That's totally fine. But the skepticals or the laggards is usually they adopt ways that only works in their hand at that point, and it's probably not going to be used by the future generation. And this is probably not something you want to teach.
yeah.
But that's how I go by. I'm try to be one of these early adopters. I believe in technology. I try to make it work, even if it's at that moment is not working. I'll try to make it work in some way. And I think in the current era that we are at now is just it's moving very fast.
Yeah.
And if you are not from the early adopters or the majority who accepts, then in no time you're gonna be an outdated for and very far away from the reality.
Yeah, and change is not easy for us usually. So
Yeah,
um,
yeah, I agree. Change is not easy for anyone,
yeah,
but you have to keep an open mind that there is new things coming up. There is new research coming up. Of course, be very analytical when you find research and see which paper is actually uh, genuinely presenting a good idea that's applicable, evidence-based. Be very critical of that because there's plenty of articles that's
Garbage.
garbage.
Yeah.
Not
and
gonna
I
work.
think if you want to become critical, you should exercise that part of your mind to be more analytical than just memory. That
Definitely.
a big point that you mentioned earlier before.
Definitely, exactly. You want to reserve all the energy of your brain to analyze instead of having a big chunk of your brain cells trying to memorize things that probably in a few years is not going to make sense anymore.
Or just you can just check it out on your
Oh,
smartphone,
yeah,
right?
exactly.
Nowadays, yeah.
You have access to them, then you don't need them in your head.
Yeah.
Yes, that's true.
Yeah, but the thing is that in order for you to exercise your brain, you need to stop telling the machines to think for you.
But I think there is a big difference in just the
Juan
mach-
knows, for example, I recently joined ChatGPT. I think it was last year.
Yeah, me too.
I'm basically a caveman. I know. I mean, I don't care. But yeah.
I don't think ChatGPT was there longer than 2 years
Okay,
ago.
okay.
It's
Then
not that
then
long.
I
Yeah, I
was
think it has like 2 or 3 years only.
oh
Yeah.
okay. So I wasn't that old, that bad.
You are in the 34%. We are because I also started using it last year. Like,
Oh, okay.
It's it's using the technology to your benefit instead of depending on it.
Yeah.
but you'll be surprised how many people haven't tried it. But right, Ernesto?
Yeah, yeah,
Yeah.
yeah.
Yeah. I didn't try it before. Juan introduced me to it, and it was now I know how to use it.
Yeah, it's still and you need to be wary of the hallucinations and
Yeah.
fact checking the information you get from
Yeah.
it.
Oh
But
yeah,
that's why we say, of course, you need to develop that ability to analyze the information that you're getting more than memorize that information per se.
Yeah,
So
absolutely.
Mhm.
Absolutely. So moving on.
yes, let's go for the ITI. Go ahead.
Let's go for the ITI. So what made you join the ITI personally? What will you say that say, hey, I want to join this team?
My ITI journey started in 2016.
Oh, that's long ago.
2016. That's about 9 years ago now. 10 years
No,
ago.
but yeah,
Yeah.
but 9 years
You
ago.
were a scholar first, like a fellow first, and
I
then
I actually wasn't. I was a resident in implant program. So I was doing my implant residency, and the program offered being a student member of the ITI if you are.
okay.
The good thing was the whole program also was built based on the ITI philosophy. So we were doing plenty of articles, ITI articles, reading and assessing and watching ITI conferences and attending ITI conferences at that stage. And at that time, the amount of information I managed to get access to from the ITI,
Yeah, it's
the
crazy.
videos, the lectures, the conferences, is just it's
It's crazy.
enormous.
Yeah.
It's a huge amount of information that you have access to. And they're all being filtered and curated, and it's like the best of the best here in front of you that you just have to read, get familiar with it, and build your practice around it. That's what you basically need to do. So that's basically what attracted me to it. That's I have access to all this in one platform. And the first conference I attended for the ITI, that's what brought it all together. Having all
Which
these
was it?
people. It was, I think it was the World Symposium in, I think 17 or 18, 2017 or 2018. And that was the change of mind straight away. That was, okay, I don't want to be just a student member anymore. I want to be a
I want to be a
member, and
big guy.
I want to be a member, and then I want to be a fellow, and I want to be a big person in this community because everyone is around you. The whole world is
Yeah.
sitting together trying to create consensus for practicing dentistry. And the philosophy of it is every member of it will carry the same principles with them back to their practice. So you're basically, whatever you do here in the US is the same thing what a person in Europe is doing. It's the same thing a person in South America is doing. Same thing someone in Africa is doing. So that makes consistency, makes predictability, and evidence-based practice everywhere. That's all you need. That's all you need to know.
And
And
hold on.
talking about consensus, yes.
Between,
We
oh,
have a
you were
big
saying
news today.
you're saying it. Who's announcing it?
I don't know.
I'm live on Instagram right now.
Oh, really?
Yeah, so people's watching. Some people are watching. So maybe you can announce it.
Okay, so thank you for Dr. Wakeel. He is giving us, with the help of ITI, a book of the ITI Consensus Guide. Which volume is it? What
It's
volume is it? I'm sorry.
it's volume 13.
This is Ernesto's favorite.
Ernesto's favorite. It's talking about peri-implantitis.
Titus. Yeah, we're giving it away.
Okay, so keep it, keep it up with us. Today we will be telling you how to participate and how to get this free ITI consensus on
Yeah,
peri-implantitis.
the
And we'll
consensus
be sending it to you, right?
yes, sir. The consensus for ITI are really, really big and really, really good.
Yeah, actually, that's, I think, something that we should apply for all the areas on dentistry, because in some areas of dentistry, we don't have that consensus. We have a major divisions and we are allowed to have the different opinions, but if we are focusing on the benefit of the patients and coming up with a treatment that will benefit most of them, we should be able to gather this information and make a consensus on the best practices. And sometimes there are many divisions between us and different areas of the dentistry. So
Somebody sent us a message and said, please, bring me one.
okay, so just keep and follow us,
My
and you will
phone.
get more information about how to get the ITI
Yeah,
consensus. Thank you.
yeah. You're gonna get the book if. Oh, I'm pointing at myself. See, this is why I don't want to do this because I'm some sort of a caveman. Okay, here we go. I'm still on my face. Okay, here it is.
Yes,
This
ITI
is the
consensus.
Yeah.
this is the volume 13 English version, Prevention and Management of Peri-Implant Disease. Actually, one of the best books I've read about peri-implantitis and management. It gives plenty of options for different case scenarios, with all the guidelines, the materials to be used, the pictures as well of the cases and the outcomes from it. So it's a very comprehensive guideline for someone who is placing implants. I'm pretty sure anyone who placed implants, they've been across cases with peri-implantitis. It's
Sadly, yeah.
It has to be.
All of us, yeah.
It has to be.
All
If
of us.
you haven't seen a case of
You haven't
preimplantitis,
placed any
you
implants.
haven't placed enough implants yet.
Have you been able to participate in one of these consensus yet?
Well, I've attended plenty of them. I haven't been in any of them as a major
Oh, sorry.
participant in
Oh,
them,
yeah,
no.
okay.
But we
Okay.
vote on them because I'm a fellow of the ITI now. So we vote on these
Coming
consensus.
soon, coming soon.
Yeah, hopefully.
Now, before you go, I have one, like, if we have time, one last question, probably. It's about you, because in the prosthodontic area, what is your thoughts on, immediate or delayed restorations on dental
Restorations or implant
implants?
placement?
Both. Okay, so let's say if we put the implant, what is your thought on immediate restorations, especially for those full arches, full mouth rehabilitations? Because today's we have on the Instagram, we have these crazy videos. They extract all teeth, put 6 implants, and then you get the final restoration right there, right and now. So do you have any thoughts, or if what would be your recommendations on this type of cases and that?
First, I want to say that I think we're extracting too many teeth.
Yeah. Don't
I-
get me started on that. Please.
I think we should change our focus from yes, implants are successful. Yes, implants will integrate. I agree on that, but I think we are taking out too many teeth unnecessarily that could have served the patient much longer time. So that's number one. Number two, my opinion regarding immediate versus delayed. Research currently is at a point that says if you place the implant immediately after extraction, or if you place the implant after complete bone healing, the outcomes is there's no significant difference between them. You can do it immediately or you can do it delayed. The difference between them, the research says now, there's not much significant difference in them.
Yeah.
However, what I aspire for in the future for a more comprehensive research, because what we're seeing clinically and outcome-wise, implants that has been placed immediately in extraction sockets are performing better actually than implants that placed in the healed site. The cortical bone in the socket area, it engages better. You get good primary stability. The soft tissues architecture is preserved. The bone thickness is preserved. Yes, you get some bone loss, but not as much as what you get when you have a healed site. And of course, the time saving, the surgical intervention saving in the whole thing, it adds on much more to the immediate placement. But I'm hoping for a comprehensive paper that's bring back all the information, maybe a meta-analysis, or maybe even a split mouth comparison to see actually that if the immediate actually perform even better than the delayed. Now, in terms of the restoration, that's a whole different thing. For a single implant, 2 implants, partially edentulous cases, I don't think there is a necessity for immediate restoration. There is no point doing that. You can put a provisional, immediate provisional on it, completely out of occlusion. That placing it to be in load immediately, it has very severe consequences on the implant itself, and it adds very minimal benefit to the patient. Another 2-3 months later, implants are integrating much faster now. It will be restored and you will have much more success rate. You don't need to compromise the success rate of the implant at that stage. In the full arch cases, it's a little bit different. immediately place implants in full arch cases, it need to be splinted to have a better success rate. You need to have them connected to each other to decrease the micro movements between them, so that because patient will eat, they're not gonna go starving after you place their full arch implants. So you're gonna have to deal with that. But you want to prevent micro movement of these implants? Yeah, you need to split.
Splint it. Yeah.
Would you splint them and with a final restoration? I wouldn't do that. It's too early to decide that the patient who came to you to have all their teeth extracted, putting implants to replace them, they are not coming in with healthy teeth, correct vertical dimension. They probably collapsed. They probably lost teeth over decades. So you can't just estimate where your final restoration from whatever in front of you at that point of time. What you need is something easily to adjust, easily to be removed and placed back. Is it easily trimmed? You need something acrylic, something plastic. You put it provisional in the patient mouth. So that's whenever you need to do adjustments, you need to correct, change vertical dimension, it's easily adjustable. And in the same time, it provides that splinting that you're requiring for those implants. And then 3-6 months later, healing complete. It serves good for the patient to eat on. It serves good for the aesthetic purpose. Pronunciation is restored for the patient. And 3-6 months later, healing complete, replace that provisional with a final restoration. It's with the current technology that we have, 3D printers and milling machines and CAD/CAM technology, it's getting cheaper and cheaper every day. It costs almost nothing to get a provisional restoration placed in the patient mouth. If it's fractured, it's fine. Print another one, mill another one. It's not going to be the end of the world.
Okay, guys, there you have it. I think that's a very nice way of ending today's episode and today's session. I don't have anything else to say. Actually, that's very to the point, and yeah, I agree with all of that. So
Thank you.
yeah, Ernesto, you have anything else to add or
No.
ask?
He explained everything very well. So, and then this is, yeah. And I'm his offspring, so.
Okay, so you cannot say
I
no.
hope, I hope the time that you spent here with us, it's actually got you a little bit interested in prosthodontics than what you used to be.
I mean, I'm not interested in it at all, but now I can say that I can do a little more with my hands about it, and I know a little more. And it's important to know about it. Yes.
Yeah, of course.
But
Dr.
interest-
Wakeel, thank you very much for today's, and thank you for joining, and also thank you for the book that we will be sharing with someone fortunately and lucky from our
My
audience.
pleasure.
So
My pleasure.
I hope
Thank you
Sorry?
for having me around.
No. Thank you for joining and accepting this invitation. I hope to meet you soon, hopefully, also. And yeah. So everybody, thank you. Ernesto, thank you. Gracias
you.
a todos por haberse unido en esta sesión de Dentíficamente Hablando. Nos vemos.